So we were just discussing the impact of winter weather in Quebec, and it's one of the factors affecting hospital emergency wards, which have been over capacity. Marie Coleman is the Chief Executive Director of Santé Quebec, and she joins me now. Robin, thank you for making time for us.
You're welcome.
So first, let's start by just sort of setting the scene. What is the emergency room situation like right now?
Well, the emergency rooms have been under pressure over the past couple weeks. The global provincial rates are around 133%. And the past week, and obviously the temperature of the past couple days contributes as well.
So what are you seeing most people come in with when it comes to those injuries? Certainly, we've been talking to a lot of physicians and healthcare workers about the flu situation, but these icy conditions over the past few days have also led to a lot more different sort of types of patients coming in too.
Yeah, well, when we have conditions like we've had the past couple of days, we always expect to have different injuries resulting from whether it's accidents or falls. And that adds, unfortunately, this year to the increase in influenza and gastro that have been circulating a little bit earlier this year than what we've seen over the past couple of years with the we can't say yet if it's a peak, but definitely with an important increase in cases during the holiday period.
So what steps are you recommending for people to sort of alleviate the pressure right now in emergency rooms?
Well, we still have about 50% of the consultations in emergency room that are considered for non-urgent conditions. So we always like to remind the population to call 811 before going to the emergency room, obviously, unless it's an emergent condition. We have healthcare professionals that can help guide them through different options that are available for them without having to consult the emergency room.
In terms of the increase of use of emergency rooms right now, is there any way to sort of qualify it? Has it doubled during this particular time or tripled in the past several weeks?
Actually, the levels that we have right now are very similar to what we saw in the holiday period last year. It's just that the types of cases vary from one year to another. This year, there's more influenza than there was last year. However, fortunately, the levels of the number of patients that consult the emergency room is quite similar to what we saw during the holiday period last year.
And is there any advice also for people who might be out on those precarious walkways to avoid a trip to the emergency room?
It's really important, as much as, it's difficult because we want to get out there and go and visit our loved ones in the holiday period. It's really important to stay put and not to go out when conditions are like they are now, unless it's really an emergency to do so, or for essential visits. However, and try to avoid putting themselves into a situation where you can be at risk. And this goes for the falls related to maybe the icy conditions, but also when it comes to getting out and about to visit loved ones during the holidays if we have symptoms of influenza.
Robin, thank you so much for your time and that good advice as well.
You're very welcome.
That was Marie Coleman of Santé Quebec.